right, so thank you very much, Dr. Wright, Dr. Scrace, Secretary Kunkel. Let's go to my last set of slides, which are going to talk about the public health order. I want to do the trends one more time. So if you look on the left side of this, the last 14 days, we've got 3,068 cases. In the last 7 days, 1,736 cases. I wanted this in particular so that you can get a sense about the aggregate. You can see it in the 79% increase in the stark, right? We are not flat, we have a vertical line, but now you can see what this constitutes in the number of cases. And we know that, right, there's a percentage of those cases where we know people are going to get sick, we know people are going to go to the hospital, and we know that we're going to lose New Mexicans, all untenable. And again, I want to remind folks that we don't have the same resources that most states do, and I would say the entire country has insufficient resources to meet the public health and the healthcare needs of all Americans. But New Mexico has the lowest amount per capita in the country. So we have to do it better than everybody else in the country, and we can do it again. So we're going to make some changes. I want to also show you what else is going on. That the number of cases that we're seeing early on, we're an older population, we all banded together, we had very strict requirements for, and we still have them, for long-term care facilities. We asked all of our older New Mexicans to stay home. We asked you in a very strict stay-at-home order to do your part to keep our chronic care individuals and our older New Mexicans as safe as possible. But now look where the cases are. Look at the growth that's going on between the 20 and 39 age group. 44.6% of our cases over the last 14 days are in this age group. And look, even though in the last 7 days, it looks like it's a small uptick, these small upticks amount to an extraordinarily high number of additional cases. And I also want to point this out because this is a trend that we're seeing nationally, that we're seeing a large number of cases in this group, the Hispanic group in that 20 to 39. And why is that important? Well, I'm going to have a lot of folks challenge us in New Mexico that because we are a minority majority state, that it makes sense that the number of cases we're going to see are going to be in this population. And that was not what we were seeing in terms of transmission and spread early on. And why is it significant? Because it speaks to the behaviors of this age group. And I worry the notion that we are completely safe, that New Mexico felt really good, that we were in the green, that we were beginning to reopen, and that it was an invitation to resume some of your backyard parties and sports and family gatherings, less safe work practices. And where we are today is in an untenable situation that if we don't get control over, will create not only the kind of capacity issues in our hospitals and an increased number of deaths that will occur in the state that are absolutely preventable, therefore untenable. We will have impacts with kids. We will have long-term chronic care issues, which is why Dr. Scrace wants all of us to take heed and notice that we are learning more and more about the damaging health effects of this virus, and it's not good. And now it looks to be diseases and impacts in the brain and neurology issues that we will still be studying. This is incredibly dangerous and damaging. And without a vaccine, the only thing we have in terms of our own defense is not to get it. And in order not to get it, we have to do everything we can to prevent transmission. So next slide. So I'm amending the public health order. It's effective Monday, July 13th, and I'm going to go off script for a second. So I'm going to talk about all the things that we're going to do, and they're painful decisions, and I need everyone to the highest degree possible to be on the same page. This is not an invitation to start these new efforts and behaviors on Monday. This is to give everybody, particularly businesses, time to make the adjustments that they need to make. But I'm asking everyone immediately, wear your mask, restrict where you're going. If you can work from home, work from home. Do not engage in unnecessary activities or where you're coming into contact, even with family members, because it's contributing to the transmission in this state. So we're going to go back to the restrictions that we had for indoor seating at restaurants and breweries. The capacity limits, 50%, are still in effect for outdoor dining. I know that some jurisdictions, localities, worked at increasing your outdoor spaces. I think these are good concepts to accommodating people as safely as possible. You saw Dr. Scrace's slide that indoor space, not having adequate ventilation, knowing that these droplets can travel 18 feet, they're airborne, they stay. The virus is airborne. This is a risk setting we cannot tolerate while we're trying to get back to flattening the curve. So they can still do patio, I said that, outdoor seating, I said that, 50%, I said that, of maximum occupancy. They still have to adhere to COVID safe practices, and so do you. And so when you are eating, of course you won't have a mask on. But you must show up to your favorite restaurant with a mask on. Otherwise, you should not be served. And I really want to make that point. If you don't do that, you're putting these businesses at further risk. You know, businesses in and of themselves aren't creating the risks. People are. And as a result of those behaviors, we have to restrict your access because I can't manage 4 New Mexicans whose lives we're working to save the risk without doing it. So I just really want to point that out. Restaurants did not do this to New Mexico. New Mexicans did this to restaurants. You can continue to provide carryout and delivery services. Breweries can continue to provide curbside pickup services. Next slide. State parks are not open to out-of-state residents, so no more out-of-state guests. What we saw for July 4th was a clear demonstration that we've got way too much going on in terms of travelers who provide risk. They bring the virus in. We can't manage that. And so the same issues when states did lockdowns and asked all of their state residents to stay in their own neighborhoods, in their own homes, in their own communities. Do not travel unnecessarily. We're going to go right back to that. One more time. State parks are open to New Mexicans only. Out-of-state guests are not going to be able to participate in any of our state parks or lakes. Visitors have to demonstrate your proof of residency. So you got to have your state license plate or state ID, or you're not going to be permitted entry. Camping at state parks remains prohibited, so day use only. Visitors have to adhere to physical distancing. I mean, the virus spreads by having folks come in to contact. Now, I get a lot of pushback, and that's my job, so I want constructive criticism. And I get lots of folks who call in who are terrified when they're out visiting a park or going for a hike, parking their car, spending some quality time with their families, and they'll send us photos on our complaint line, you know, our non-healthcare related hotline. And it really is stunning to see that folks are not adhering to any social distancing. Nobody has masks on, and it means that you are coming in too close contact with other individuals. And while it might feel safe because you're outdoors, I need folks to take seriously these social distancing requirements. They will, in fact, save lives, and one of those lives they save could be your own. Next slide. If we don't flatten the curve, we got 5 weeks, and we expect, given that we're seeing the impacts of the changes we made, introducing risk, Memorial Day weekend, June 1st, we're seeing those impacts now. We should expect to see that we're going to have increased cases. We won't see the benefits of our behaviors for at least 14 days and beyond. That means if we don't start right now, and if we don't see increased personal behaviors that limit transmission and prevent transmission to the highest degree, we can't safely reopen schools. Our kids and our families are depending on New Mexico to get this right. I'm depending on you to get this right. So I really want to be clear that while we would do everything in our power to save lives, and we are, that the goalpost immediately, because we don't have the right treatments and we don't have a vaccine, is that if we're going to open schools in August, we have July basically to get back where we were and to get into a place where we can see that we are stable and that some counties would start to see a decline in the number of infections per day, per week, per 14 days. Our students, our educators, and their families have to be safe. And I'm getting a lot of interesting feedback here. You know, we want this hybrid model to work. We are hopeful that this hybrid model where we have some distance learning at home, we have kids coming 2 days a week to school. This is a very complicated model to work. It's a slow, thoughtful, productive way so that we don't close schools halfway through. The whole point of this and what we've learned in reopening businesses, that when you reintroduce risk, if you don't do that in a moderate, slow, safe way, you can have results that give you only one option when you have increased cases, to just go back to closing things. And we don't want to do that. Our kids deserve the slow model and then to get to a 5-day school week as quickly as possible. And I also want to point out that when folks are talking to us, they remind us, and we've got a pediatrician here, that the risks for kids, even though it's not that there's no risk for young people. That's not true. And we're finding more and more issues related to having COVID-19 as a young person, as an adolescent, as an elementary age school kid. The issue is, in addition, that you can have an exposure and significant issues, that our educators and families are at higher risk for consequences related to getting COVID-19. So think about all the people that work in education. Your teachers, your teacher aides, the folks who are making meals, the principals and administrators, the custodians, everyone in the system. We have an obligation to keep them safe, because if they get sick, there isn't anyone to come to school and provide those services for you, and those risks are too high. As a result, we've made the following additional decisions. Fall sports. No contact sports are going to be permitted this fall. This has been a decision that we have been doing a fair amount of hand-wringing on, because sports are incredibly important to the individuals who play them. And we are clear about that, about the social behaviors, about the team building, about the life lessons that are learned in playing sports, and about the impact they have on the quality of life of the individuals playing, the coaches, and the families. But these contact sports are just too high risk. And if we do well, we work hard, it is possible that we can just be delaying them and they can be played later in the year and then later into the season. I've got my fingers crossed, and I believe in you that we can get this done. And this has been very painful, and we're working with the New Mexico Athletics Association on creating the standards and getting information out to schools and coaches and teams. And I already talked about the modified schedules. I'm not giving up on it yet, but I do want to let everyone know that we are delaying those. Other non-contact sports are under review, and they'll likely have a delayed start to their seasons, but I'm feeling as confident as I can, given the current situation we're in, that we can get them done. So golf, tennis, as examples, and not that they're the only sports, but just examples. Read the yellow at the end of this slide. None of these sports, no fall sports, are going to happen if schools aren't open. They're all tied to schools being open. We have to do better and get this virus under control. Next slide. We're going to get on track. I believe that. I feel incredibly motivated to end on the highest note possible, but I also want to be unequivocally clear. We talked about what would happen if we couldn't bend the curve. We talked about not only the fact that we have an obligation to save lives, and if I can't get folks to do it, I would make the decisions that would make the public health risks as minimized as humanly possible for the entire state. I believe we can do it again. But it isn't going to be easy. And all of these changes and issues are painful for every single business that is impacted and affected, and every single New Mexican who works there, who wanted to participate in supporting those businesses, and every student who's had an incredible shift in what they can expect in their schools and in their teams and having any time with their friends. We owe it to them to get this right. The virus did not go anywhere. We have been talking about that. It is here. It is a vicious, dangerous, silent, invisible enemy, and you have to treat it as such. Every time you go out of your house, you are exposed to this virus. It is living amongst us. It is everywhere. And if we let our guard down even for a second, and we did that in New Mexico, the whole country did that, it will continue to spread with a vengeance. The only way is to do it together and to be clear that everyone has a personal responsibility. We must adopt a zero tolerance policy for risks and risky behavior. That means that these must be worn, face coverings at all times when you're outside of your house. If you're for a walk, you need to have a mask on. If you're at the gym, you need to have a mask on. If you are taking a walk and window shopping, you have to have a mask on. We tried to create a sense that exercise and being outside, as long as you weren't going indoors and engaging in businesses or work, that, maybe there were some exceptions. There are none anymore. Zero tolerance policy for not wearing a face covering. It is the only way that we get back on track. Again, I need you to stay home to the greatest extent possible. Every time you leave your home, it's a risk. I don't want anyone gathering in groups. We get story after story, contact tracing after contact tracing. I went to a wedding. I went to a backyard barbecue. We were playing rugby in the park. It's a violation of the current public health order. And we are seeing the results of that play out in the number of increased cases we're having and the exponential growth in county and community spread statewide. You got to wear a mask. I've said it over and over and over again. I'm going to keep saying it. You have to wear it when you go out, and you got to get back to social distancing and washing your hands. If we're not going to do that, we aren't going to be able to get control again. Do I have another slide? I don't. All right. These are tough decisions. They are decisions intended to make sure that we aren't making false choices between school and the economy and protecting New Mexicans. What you're seeing across this country is an indication that we did not mitigate risk by personal behavior sufficient to warrant some additional risk taking by having some businesses open and by slowly looking at economic recovery. We have the power to fix it. And while it's disappointing, I think, for many New Mexicans and certainly the businesses, what I hope we're sending is that we have the power to make it right. New Mexico has shown over and over again that for a sparsely populated state with not all the right resources, that we can lead in any number of ways. We can lead by being the #1 state with compliance. We can go from what we believe to be a 35, maybe a 40% compliance rate, mask wearing. We can go to 80 to 90%. It just depends on you. And I want to give one last example before we go to questions. Fairfax County, Virginia has a population of, I think, about 1.1, maybe it's 1.3 million. Point is, it's a much higher population than Albuquerque. To put in comparison, day before yesterday, they had 16 cases. Yesterday, they had 30 cases. Albuquerque's got well over now 90 cases. You know what the difference is? The difference is personal behaviors and how we mitigate risk. We must do better as a state. So New Mexico, don't forget, we are in fact all in this together. We have the power to make a difference for every single New Mexican. Thank you, and Nora, we are now ready for questions.
Thank you, Governor. First, I'm going to go to Matt Grubbs with New Mexico PBS. Matt, you are unmuted. Go ahead and ask your question.
Thanks, Governor. Thanks for the opportunity. First, a quick clarification. The slide that you had regarding restaurants said that indoor dining would be restricted. My understanding in your comments is that it's prohibited, and that the restrictions, the occupancy restrictions, apply to the outdoor patio. If you can clarify that. And then secondly, there was a pretty well covered instance of a pet store worker in Albuquerque who was threatened when he asked a customer to wear a mask. It's my understanding no citation was issued in that case, that he may have been contacted by an off-duty officer, and I don't know what the result of that was because there was no report filed. Is that how you want those instances handled? And if not, how do you want them handled? Thanks.
Thanks, Matt. So I didn't bring a pen. I tried to remember to bring a pen so that all of the folks who asked me multiple questions, you tricksters, that I could manage them in a much more productive way. So your first question, yes, what you took away from that slide is accurate. That the restrictions remain in place, which means 50% of occupancy for outdoor seating. Indoor dining is prohibited. So you got that exactly correct, and I appreciate the opportunity to make sure that we are clear and that restriction, those restrictions and prohibitions will be in effect on Monday with the execution of a new public health order. And the case that you're talking about in Albuquerque, I believe occurred with someone I'm going to refer to as a younger person who, store clerk or manager of that pet store, who did exactly what we want. A business that is adhering to COVID safe practices, who says to a patron in that business, sir, you must wear a mask. In response, the person appeared to have negative aggressive behavior that was taken after being reminded again by the individual in the store as a threat, and either alluded to or pointed to a firearm. I don't know enough of the facts based more than that I've read, whether it was a concealed carry issue or just that you could see the firearm. That kind of intimidation, no, it is not what we want to have happen. And in fact, it's really outrageous. That business can't stay open without meeting those COVID safe practices. And quite frankly, you shouldn't be in there without a mask. And intimidating a young person who frankly is putting their own life at risk by having the store open for you, I find to be outrageous. The second part of that story is, as I understand it, that an off-duty officer was witnessed this negative communication and alleged intimidation occur and did not file a report or didn't do anything about it. No. And I am sure someone else is going to ask me about our fines and enforcement. And look, we are working now with 40 different law enforcement jurisdictions to help us in enforcement, and we're doing a better job at leveraging and working together, even with, I will tell you, law enforcement jurisdictions that may not agree with our public health orders, but recognize they're the law. My expectation is that if that fact pattern is as it sounds and was written, that I would expect that the mayor will require that police officer in short order file a report, and that the individual, if we know who that is, who was intimidating and intended based on the fact pattern that was written about, is held accountable for A, not wearing a mask, and B, intimidating the person who was following the law at the store. I am really appalled by that kind of behavior. I got it. Not everybody believes that you have to wear a mask. Understood. But a public health order is an enforceable order, and it saves lives. There is no dispute in the medical community, no dispute about the efficacy at lowering transmission rates by wearing face coverings. It is a small thing to ask New Mexicans, even New Mexicans who don't want to do it. And as you heard, and I'm probably answering too long, I was around, Dr. Wright, for debates in this very room in the New Mexico legislature about smoking in public, smoking restrictions, about child seats, and increasing penalties for not wearing seatbelts and enforcement of such. They are tough debates, and I will tell you that in every state, these debates occur about these issues that are intended to make sure that we all are safer and that we are looking at public health information and data that reduces injury and saves lives, right? We do that. When you pass the laws and you get unequivocal, right? Unequivocal medical scientific evidence about preventing injury and death, we do them, even if you don't like them. So I'm very disappointed in that interaction, and I am loath to tell New Mexicans that it is not an isolated issue, that we're seeing very negative communications on social media, incredibly negative interactions in businesses. And I want to thank all the New Mexico businesses that have done everything they can to help reduce transmission, who are often the subject of the wrath of an individual who is not doing their part to protect us all. And I want to thank you for that. I want to thank the young man who stood up for every New Mexico business, who followed the law, and who did his job so effectively. And no, it is not what I want to have happen on the front end or the back end, Matt. So thank you for raising it.
Next, I will go to Chris McKee with KRQE. Chris, you're unmuted. Go right ahead.
Thank you very much. I had a question regarding just kind of the enforcement issue. So as we've all heard, enforcement is going to be aggressively enforced. I believe that was what the governor had said last week. Santa Fe Police, as I understand, has written around 8 citations. State Police, as we understand, and there could be updated numbers, so correct me if I'm wrong, has cited somebody, a single citation rather, in Clovis. Numerous other law enforcement agencies have been quoted saying they won't enforce the mandate, or some have signaled, yeah, we'll just keep issuing warnings. So my question is, without aggressive enforcement, are you worried that this mandatory mask measure isn't being taken seriously? And what is the message to those people who say, quote, I don't take the mask mandate seriously because there is no enforcement?
I wish, Chris, that there was no enforcement necessary. And again, I'm going to go back to even seatbelts. If you didn't enforce, I can tell you that we would not have the kind of compliance and the number of lives we've saved as a result of traffic accidents and car accidents, particularly the number of children whose lives have been saved by car seats and appropriate seatbelt use. It took a decade or more of citations, enforcement, communication, education, because human behavior change is not easy. And I don't want to do enforcement. And I can tell you there's not a police officer, given their jobs at any number of significant other public safety issues, that they are responsible for in this state. But they do it because they know they're saving lives. And we've had 40 different, and we're gathering up more, because I'm happy to take responsibility for this. Like when we said, if you're exercising, you don't have to wear a mask. And now we're saying you have to wear a mask if you're outdoors, that's it. And we're going to include in our public health order on Monday, although I didn't talk about it in our slides. If you're at a gym, indoor spaces, you're wearing a mask. And it's hard. But think how fit New Mexicans are going to be. And if you're training, you're going to be amazing, because this is what they do actually for high altitude training. They'll have you wear a mask in addition to running at high altitudes. So we know it can be done. We know it's used by professionals, and we're going to require it. But if we don't enforce, it's really unfair to both businesses who are trying to enforce and individuals, and this confusion about if you're walking around, is that exercise? So we've eliminated that confusion. We are being very clear that warnings are not fair and not enough, and we have such a short order. I don't have a decade to get New Mexicans and Americans comfortable with wearing masks. Here's what I predict, Chris. I predict that Americans are going to have to be much more comfortable given what we're seeing in pandemics and epidemics and infectious disease concerns with wearing masks and face coverings and changing our behaviors. And I believe, based on the worldwide scientific evidence that's emerging, that we're shifting human behaviors, not just for COVID-19, but potentially forever. But I have very little time to save lives. And we will enforce. And we had state police in many locations, including, as you know, Elephant Butte and park rangers, and we're going to leverage every tool. We didn't give out hundreds of citations, as you know. I believe it's more than the one citation. I thought it was Portales, but we'll make sure we get those numbers to you. But I'm hoping that when you ask me this again, if I come back to you, if the numbers keep escalating like this, we might have a press conference like we were doing every couple of days. Because we might have to make announcements and make adjustments every couple of days, whatever it takes. But I hope that I come to you with, we gave one mask citation. And that one mask citation was to somebody from out of state, didn't pay attention to the quarantine, and didn't pay attention to the fact that they're not supposed to be here. And that all New Mexicans from this day forward are wearing masks and protecting each other. But this is what I expect, and I do think that leveraging and more law enforcement entities are coming to our aid because the public health evidence is clear. One last thing about that, Chris. Will every jurisdiction help us in the way that I think that they should? I bet not. And we will work with the Attorney General to continue to remind them that they should, they can, and while the state enforcement issues are mandatory and clear, we expect participation. And I'm going to do everything I can to get them to do their part. Again, we're all in it together, and without them, we're not going to have the impacts that we need to see immediately. Next question.
Thank you, Governor. Next, I will go to Michael Gerstein with the Santa Fe New Mexican. Michael, you are unmuted. Go right ahead.
Thank you, Governor. Appreciate you taking the question. Obviously, under the new public health order, some of the eased business restrictions are being rolled back again, while others are still kept in place, such as outdoor patio seating and gyms. I'm wondering, with the spiking cases, why not institute the more restrictive health orders that the state saw at the beginning of this pandemic?
Really good question, Michael. And we debated this using the modeling and the science. And I alerted New Mexicans, as you are aware, last week that what we were seeing in these upticks, and again, we want a trend line, did not bode well. And we were worried about Memorial Day weekend. And we gave our sort of cautionary, this is not an invitation. I mean, I think that's exactly what we said. We're easing restrictions. We're reopening the economy methodically, slowly, as safely as we can. It is not an invitation to be out and about. So why not go right back? I know that we have to live with this virus for at least a year. If we don't find a way to balance these behaviors, then the only way schools would be reopened is to have a complete lockdown except schools. I don't know how that can even work in the context of having people at work and having enough childcare workers and making sure that those childcare workers who can go to work because they have a spouse working, I don't know how all that can be sustained. So this is what I believe. I am not afraid to make incredibly tough decisions. I got elected to govern the state and to make the decisions based on the evidence at hand that I think is in the best interest of the state. These are not easy decisions, and I do not take them lightly, and they are not decisions that any governor wants to make. But saving lives is a very easy goal, right? My North Star is to be unequivocally focused on saving lives and protecting New Mexicans, all ages, all locations, all persuasions, all genders, all ethnicities, all races, whatever it takes. I think that the indoor dining issues are significantly risky. We've only had one rapid response in a gym, and new data is emerging that with face coverings and the limited number of folks participating in gyms and their social distancing while they do that seems to have the right mitigating impacts. Restaurants, through no fault of their own, just don't have the right systems when you've got 50% even capacity to mitigate, and you don't have masks on to mitigate transmission. I want to be very careful. There's no one here and no person on the modeling team or the medical advisory team that thinks restaurants are bad actors. It's just that it's an environment that is not conducive to mitigating spread. If we wear masks, the decision that I made today is a sound, evidence-based decision. And this sort of roller coaster of rolling back is not only incredibly hard for individuals to manage, it's incredibly difficult. I don't even know that it's manageable by businesses. And so I think this is what we ought to do. And New Mexicans, don't prove me wrong, but to your point, if it doesn't work, we will have to have even more restrictions, because those are my only two tools: personal behavior, social distancing, hand washing, masks. That's all I have. I don't have a vaccine. I don't have a treatment course. I can't see it. That's all I have. And restricting where you can go. Those are the only two things in the toolbox. So I'm backing off, eliminating known risk, and pushing hard enforcement, masks, business COVID safe practices. Dr. Scrace.
I just had one last comment. I think, Governor, you covered everything very well. But I actually think that the main reason to do what we're doing now is that the science has changed about masks. Back in March, there was conflicting data, and there have been a dozen papers now that demonstrate they're effective. I personally think the best method for flattening the curve, bringing it back down again, is actually just getting 100% of New Mexicans to comply with public health orders. I think if we wouldn't be in that situation had that happen, and I think we still have the biggest leverage we have is complying with the public, creating a society where we all feel good and encourage each other to comply with public health orders, including masking. I think that's the fastest and most effective way at this point to reverse this trend. Thank you.
And I am reminded, Chris, about one more thing. In the rapid response work that we're doing, we've had a 16% increase in infections at restaurants. And again, I want to be really clear about this. Restaurants didn't create the infection, but having people who were asymptomatic who came to the restaurant posed a risk for their employees. And we're seeing a dramatic increase in the number of restaurants who now have a COVID positive case and issue with their employees that are requiring them to have to shut down, get everyone tested, be in that rapid response environment. And so it's clear that high risk in dining issue is significant, and this is a way we think we can get it immediately addressed.